Hi, Dr. Davis, author of the Wheat Belly and Undoctored books. Is it possible to slash the risks of having type 2 diabetes? Long-standing diabetes, as you likely know, leads to such terrible complications as blindness, heart disease, stroke, cancer, dementia, amputations, neuropathies, kidney failure, and it shaves 8 years off your life on average. So these are serious complications of having diabetes for a long time. Well, can you take the drugs? And will they slash your risk? No. They may delay these things, but they won't eliminate them from your life, and they're not very good at avoiding these complications of diabetes. So is there a way to avoid all these awful complications of diabetes? Yeah, become a non-diabetic. It's not that tough. The majority of people who've had type 2 diabetes are perfectly capable of becoming non-diabetic, or worst case scenario, become minimally diabetic and maybe require one medication, something like that. That's about as bad as it gets, by the way. But it is possible for the majority to become completely non-diabetic. But you cannot rely on most doctors to help you get there, nor diabetes educators. So that's what we do in the Wheat Belly and Undoctored programs. We follow a diet and a nutritional supplement program and other strategies that reverse high blood sugars and the driving factor in diabetes, insulin resistance. We reverse insulin resistance, or at least minimize it. And the majority of people can come off insulin, injectable, and oral drugs, have hemoglobin A1Cs that are lower off drugs than they were on drugs. But you have to take the effort. But it's well worth it. You can add years to your life. You can spare yourself all these awful complications of long-standing diabetes.